everyone. Welcome to the program Healthy Living on Independent Television. I am Adesuwa Osawagye. It is no longer news that the second wave of coronavirus is everywhere, almost everywhere, and some countries outside Nigeria are already embarking on lockdown. Some are already on the second wave of lockdown. Others are making preparations towards another lockdown. Yet, a lot of us here in Nigeria are not taking the issue of this COVID-19 serious. Some persons still go about without their face masks. The hand sanitizers have become a thing of the past. Only in some schools that you find the buckets and, water, washing hand basin and all of that. And very few persons wear face masks. In fact, if you wear a face mask in public, people will look at you strange. Some may even begin to mock you. Others will just look at you with, so much disgust and indifference and then go their way. But the truth of the matter is this. COVID-19 is still very much in our society, in our environment, world over. We have to observe all precautionary measures, particularly now that our children are in school. All right, you never can tell. The immune system is not so strong. All right, so we have to do everything humanly possible to make sure that we save ourselves from the scourge of COVID-19. It will not cost you anything to observe the protocols put in place to curb the spread of COVID-19. Put on your face mask, and some persons are complaining that, oh, face mask is this, is that, it's kind of shortening their breath, it does not make them breathe well and all of that. Fine. When you're in public, wear it. When in the midst of people, wear it. When you're alone, you can take it off. When you're walking and you know that people are not close to you, you take it off. And then you observe the social distancing thing, all right? For those of us who are getting married, who are celebrating one event or the other, let's try as much as we can to observe the COVID-19 protocols, okay? It will keep you safe. It will keep the next person to you safe. And if you, of course, to travel out of the country, you know what's going to happen to you. You'll be quarantined for like 14 days. And if you're coming into the country, you will also be quarantined for another 14 days. So put that at the back of your mind when you are trying to, embark on a journey. So today on the program, Healthy Living, we are going to be looking at ULCER, peptic ulcer to be particular, and other ulcers you can think of, okay? Causes of ulcer, are there complications, who is at risk, and then what can be done to treat it. Is it a treatable ailment? Are there complications that can arise as a result of not treating ulcers? These and many more we're going to be doing today. And of course, if you can differentiate from one ulcer to the other, then stay with us on the program, Healthy Living. Our call line is 052-290-573. And we're going to be meeting our doctor in a moment. Stay tuned. Thank you very much for joining us on the program, Healthy Living. What is the kidney?
The kidney is an excretory organ in the body, which is for metabolism.
Tuberculosis affects many organs in the body, but the common ones it usually affects is the lungs.
Epilepsy is a neurological problem.
Okay.
It is an injury in the brain which causes someone to begin to convulse, to go into fits.
It is curable, but the cure is a long-term thing.
If you eat well and avoid those risk factors that will make your immunity to be down, then the risk of contracting tuberculosis will be reduced.
If you're healthy, then you're wealthy. Thank you for staying tuned to the program Healthy Living on Independent Television. Like I said earlier on, we're going to be looking at ulcer, peptic ulcer. Is it one and same with stomach ulcer? Are there so many ulcers? How many ulcers do we really have? What are the causes? How do we treat them? What are the complications when you have it? How would you even know that you have ulcer? Is it something that you can diagnose yourself, or you have to go to the hospital to do so? So joining me to talk about this is Dr. Jolly Nosa Iguma. He is the CMD of Jonos Medical Center here in Benin City. Nice to have you join us today, Doctor. Okay, we're looking at ulcer, peptic ulcer, and of course, if there are other ulcers. So talk to us. What is peptic ulcer? Is it one and same with stomach ulcer?
Well, the stomach ulcer is a type of the peptic ulcer.
Okay.
And by description or by definition, we say that peptic ulcer is tissue injury which occur due to the effect of gastric juice on the upper digestive tract. Looking at the digestive tract, we have the esophagus. After the mastication of food by the tooth in the mouth, the food have to go through the esophagus, from the esophagus to the stomach, from the stomach to the small intestine to the large intestine during the process of the food digestion. So we are saying that when there's a tissue injury in the upper chamber of the digestive tract, specifically the esophagus, the first part of the small intestine, which is the duodenum, and the ileum, even the stomach too, before the intestine. When there is a tissue injury because of the gastric juice, we say the person has an ulcer. However, other than the fact that we can have ulcer in the esophagus, which is the throat, we can have it in the stomach, we can have it in the duodenum, which is the first part of the small intestine. We can also have it in the jejunum, the ileum, even in the Merkes diverticulum. All these are, the area which are classified as the upper digestive tract. But for the sake of emphasis, the commonest type of ulcer we have in our environment is the gastric ulcer and the duodenal ulcer. So peptic ulcer is classified, peptic ulcer has different types. The commonest type we have in our environment is the gastric ulcer and the duodenal ulcer. The gastric has to do with the stomach, while the duodenal has to do with the first part of the small intestine. So these are the types of the ulcer that we have in our environment.
Okay, thank you, doctor. Tell us the cause or causes of ulcer.
Yes, just like as I said when I was talking about the definition or the description of the peptic ulcer, I said it's a tissue injury which occur due to the effect of gastric juice. So when there is an exaggerated production of gastric juice, the gastric juice is an enzyme which is produced by the mucosa of the stomach that aids digestion of food. And also if there are microorganisms in the food, it helps to destroy them. And the gastric juice is specifically made up of the hydrochloric acid and the pepsin. So
the gastric juice is acidic.
Yes, they are acidic. On its own. So when there's an exaggerated production or an excessive production of this gastric juice by the stomach.
Well, what could cause that excessive production of that gastric juice?
We have found out that the commonest cause, the commonest reason why a patient will come down with an ulcer because of the exaggerated production of the gastric juice is bacterial infection. And this bacterial infection has been communicated to be Helicobacter pylori. This is a gram-negative spiral organism which can be transmitted from man to man, oral. Yes. Even during vomiting, you can also contact it from somebody that has vomited, and you have a contact with the vomiting.
So it's not because somebody does not eat or because somebody is fasting.
We have those one as a causes, but the commonest, we are looking at the commonest cause why we will have an exaggerated production of the gastric juice by the mucosa of the stomach. So Helicobacter pylori is the commonest cause.
So how does one get in contact with that bacteria?
Yes, like as I said earlier, it's man-to-man transmission. Usually when somebody vomits and you come in contact with that vomit. So that might be the reason why you have to, why one will contract such bacterial infection. And these bacteria are there to the mucosa, the epithelial surface of the stomach. It are there, and it has ability to burrow hole. And this bacteria cause depletion of somatostatin from the discs, and it also causes depletion of gas stream from the G cells, thereby causing excessive production of hydrochloric acid from the parietal cells. So what I'm trying to say is that it is physiologically, it is only when food is in the stomach that is when the gastric juice is supposed to be produced. But these bacteria tend to be a producer of an acid on its own. 90% of patients with duodenal ulcer are caused by Helicobacter pylori, while 70% of patients with gastric ulcer is caused by Helicobacter pylori. So you can answer that.
Is it possible for you to break all of that down so we get what you're saying?
What I'm trying to say is that anybody that has an ulcer, if I try to look at the cause, this person might not have other risk factors.
Yes.
As in the case of maybe smoking, drinking, or maybe prolonged fasting. The person will just come down with ulcer. We have found out that, statistically, we have found out that duodenal ulcer, which is the commonest type of ulcer, as compared to the gastric ulcer itself, the 90% of patients with duodenal ulcer, 90%, that 9 out of 10, it is the Helicobacter pylori that is responsible for it. Whereas 70% of a patient with a gastric ulcer is caused by Helicobacter pylori, whereas 30% is caused by non-steroidal anti-inflammatory drugs.
So what are the signs and symptoms of ulcer?
Yes.
How would one know that, okay, this thing I'm passing through or this thing I'm feeling is?
We can have pain as the commonest symptom of this ulcer. Though some patients can also, come without pain. That is a typical peptic ulcer, as the case may be.
No pain.
And no pain exactly, until the complication will start coming up, and I will highlight some of those complications. The kind of pain the patient will feel is pain in the epigastrum. That is between the breast, the lower part, between just the lower part of the two breasts. They feel pain there. Even sometimes this pain can also radiate to the back.
Is it like excruciating pain or just pain that will come and pass, No,
it's excruciating pain, just deep pain. They feel pepperish pain, kind of. And many a times, the pain tend to wake the patient up at night or very early hour of the day. Or the pain tend to come up 2 to 3 hours after me or shortly after me. That's a peptic ulcer. Apart from the fact that the patient might feel pain in the epigastrum between the two breasts, the pain can also be felt on the umbilicus. Where you have the umbilicus. And specifically, that is a duodenal ulcer. That is the only way we can distinguish a duodenal ulcer from a gastric ulcer. However, if a patient starts having complications like peritonitis, which is a complication of the peptic ulcer, they can have generalized abdominal pain because of the gastric outlet obstruction.
You talked about back pain a while ago, that one can feel pain at the back. Like which portion of the back can that pain
depending on the site of the ulcer. If a patient has duodenal ulcer can become complicated, affecting the head of the pancreas. That is the reason why a patient will now begin to feel pain at the back. Just, is posterior to the epigastrum. And not waist pain, the kind of, just the exact position where the epigastrum, where the gastric region is. It's in the front. The patient will begin to feel it at the back. Even sometimes they can even feel it, on the right hypochondral region, just on the right part of under the breast, or even at the upper part where the sternum is. So, however, a patient with this kind of a pain cannot self-diagnose himself or herself. You have to see a doctor for a physical examination and if possible for a laboratory investigation that we can do. Other than the pain, which is the commonest symptom, I have said that patient can also come down with atypical symptom with which they didn't even come down with pain.
At all.
They can also vomit. And the vomiting is also a complication. When the patient begins to have what we call the gastric outlet obstruction, as I said earlier, when they have gastric outlet obstruction, they will begin to vomit. And when they decide they vomit, the pain tends to relieve them. Those are the symptoms of ulcer. And sometimes they can even vomit. And the kind of vomitus you see is blood stain, hematochezia. The vomitus will contain blood.
Particles of blood.
But at this stage, the ulcer, the peptic ulcer is becoming complicated when bleeding starts coming. And as I said earlier on, they can also have generalized abdominal pain, a condition we refer to as peritonitis, because of the fact that the perforation has occurred. Ulcer has to do with an injury, just like the way you can have injury in your epithelial surface, like your skin, like your, you know, either your limb or your hand, as the case may be. So when you have an injury in this upper alimentary canal, either the esophagus, which is the throat, the stomach, or the duodenum, when you have an injury there, and I've told you what is capable of causing an injury there, tissue injury, the hydrochloric acid that is supposed to destroy microorganisms in the food will now start acting on those tissues, thereby capable of causing holes. Capable of causing holes in those tissues. It's like self-autolysis. The hydrochloric acid is not acting on itself, on its own self tissue. So that is, you know, the patho. That is the pathophysiology of this ulcer. So you can see that pain, vomiting, which can contain recently ingested food or blood, or sometimes patient coming down with generalized abdominal pain. All these are the symptoms of pain. But also, patient can also begin to pass what we call the melanal stool. When you check your stool become darkened, not frank red blood. You see that your stool is supposed to have this kind of normal yellowish color, as the case may be. But you notice that your stool is now darkened, irrespective of the food you eat. So when your food is darkened, it means that there is a digestion of blood in the upper chamber of the alimentary canal. So by so we can begin to suspect that there's a bleeding in the upper chamber of the intestinal tract. So passage of melanal stool or passage of dark color stool is also a symptom of the peptic ulcer. But however, it is not what you can diagnose on your own. You need to see a doctor, then, and this stool will be taken, then a proper diagnosis will be made.
All right, I hope you heard that ulcer is not something you can self-diagnose. You need to go to the hospital, because often the time when somebody complains about pains in some region of the stomach, maybe another person that is suffering from ulcer will say, that must be ulcer, that's what I feel. It's not one and same, okay? You need to see a doctor. Self-medication is not advised, and we do not preach self-medications either on this program. All right, doctor, let us look at the complications before we go to check the treatment and then management of ulcer.
The commonest complication we have in a patient with peptic ulcer include perforation. Perforation has to do with a tear in the esophagus, in the stomach, or the duodenum. You have a small hole that was caused by the excessive production of the hydrochloric acid. Yes. As I said earlier on, either because of the fact that you are exposed to this bacterial infection, or you are exposed to cigarette smoking, or you are exposed to incessant consumption of alcohol, or prolonged fasting, as the case may be. So you now have a small injury there. But this injury can become big. Exactly. That is when you now have perforation. In that case, now you now see that the food that you have eaten, the digestive substance might now spill into the peritoneum. It's supposed to be in a tract. Yes. So when it now spills to the peritoneum, the patient can begin to have generalized abdominal pain. So in that case now, the pain will no more be circumscribed in a particular region. The patient feels pains, you know, in every area of the abdomen.
Can death occur as a result of that?
Certainly. Other than the perforation that will now result to peritonitis, patient can have bleeding. They can bleed. And how will the bleeding present? They vomit. You see blood coming out. So that is one of the ways with which a patient with peptic ulcer can lose their life. They vomit. Anytime they vomit is blood. Anytime they vomit is blood. And if such cases is not quickly arrested, they lose all the blood in their body, and fatality or mortality might occur. Other than the bleeding, they can also have what they call the gastric outlet obstruction. So what it means is that if the ulcer is on the first chamber of the small intestine, which is the duodenum, there might be a constriction because of fibrosis. What it means is that food in the stomach can no longer pass through. So in that case, all the food will be stored in the stomach. Digestion can no longer occur beyond that level. So the patient have this nausea, tendency to vomit. So anytime the food is stored in the stomach, the patient feels uncomfortable.
Does it contribute to a patient having heartburn or something?
Well, the heartburn is a pain of its own that we normally attribute to peptic ulcer, as the case may be. That is exactly how the pain feels like. The patient feel kind of heartburn, sensation on around the epigastrum. Many a times, some persons will even mistake peptic ulcer to be a heart problem until a proper diagnosis is made, until a physical examination or a laboratory investigation is carried out. We'll not be able to delineate the peptic ulcer from the heart-related disease, as the case may be.
Okay. All right, we're still here, and you want to talk to us, give us a call on 052-290-573. We're talking about peptic ulcer here. A lot of us do have this condition and don't know what to do. You just do what other persons do. But doctor, sometimes you hear people say they have ulcer, they need to take milk and all of that. What is the treatment for ulcer?
Yes, when a proper diagnosis has been made, just like, as I said earlier on, we are talking about a patient that has what we call a chlorhydric state. Maybe somebody with a pernicious anemia. In that case, they hardly produce hydrochloric acid. That is what we refer to as a chlorhydric. So, such person might not suffer peptic ulcer.
Okay.
But, however, there are still conditions with which somebody will have exaggerated production of gastric juice, like what we call Zollinger-Ellison syndrome. There are conditions like that, not due to Helicobacter pylori or the bacteria I've said earlier on. Such person, they just have, it's a syndrome. There's an aberration. So they have excessive production of acid with them. So they must be prone to having, or they must suffer this peptic ulcer, as the case may be. So when the diagnosis has been made, you now know that you have an ulcer. Anytime you have this pain, and many a times, it is only when there's no food in the stomach, that is when you feel the pain more. That is why patients with peptic ulcer, they tend to have pain during the early hour of the day, when they have not eaten, or maybe at night. The pain tends to wake them up at night. So because of that, we encourage them to take a buffer, something that is capable of buffering the acid. And a good buffer is milk. So milk is okay. Magnesium trisilicate. Okay. That is there's a trade name, but I'm not going to advertise any of them. There's that looks like this shock mixture. Exactly the bottle you take. When you take them, you tend to neutralize the effect of that acid, and before you know, you have a relief.
I've often heard people say that, okay, this person is going for a surgery as a result of ulcer. Exactly what do they operate on? Is it the small intestine, the esophagus?
Depending on the site of the ulcer. Yes. If the ulcer is in the stomach, exactly where the ulcer is, we can just cut it off, what they call the gastrectomy. We just cut, that part where the ulcer is and do a repair. Sometimes it may also be in the small intestine. We can do a pyloroplasty. Okay. So all these are the surgical interventions.
So after all this surgical intervention, is it possible for the same patient to come down again with ulcer? Is it possible for it to reoccur?
Yes, reoccurrence is common. Like a patient that has Zollinger-Ellison syndrome, it's not due to H. pylori elimination. Say we have to eliminate the H. pylori from the stomach. Yes. But this person just it's inherent. They just produce they produce gastric juice excessively. A normal person is supposed to produce 1.2 to 1.5 liters of gastric juice a day. But a patient with Zollinger-Ellison syndrome can produce up to 4 liters.
Wow, that's quite much.
Exactly. So you can see that this hydrochloric acid will now begin to eat the tissue. Eat the stomach, eat the duodenum, and they must have an injury. So if a patient that has Zollinger-Ellison syndrome, for example, had an operation, it's possible for reoccurrence.
Are there food one should avoid?
Yes. We advise patients with peptic ulcer to avoid excessive intake of alcohol. Alcohol tends to aggravate.
So it's not that the person should not take alcohol at all, but You need to make us understand. Because you just said too much alcohol. That means somebody suffering from ulcer can actually take alcohol.
Yes, we have to start from reducing the, from stopping. We start from, it's just like somebody that smokes.
Okay.
If the person smokes like 10 cigarettes a day, we advise, okay, cut down the cigarettes to 5 a day.
Okay.
Then after some time, cut it to 3 a day. But somebody that smokes like a packet of cigarettes a day, if the person abruptly or suddenly stop it, he's most likely going to go back to it.
Have a withdrawal syndrome.
Exactly. He's going to have a withdrawal syndrome. That's why I'm saying that excessive intake should have to be reduced before you stop. When you now know that as a peptic ulcer patient, you take 4 bottles a day, you're not taking 1, and the pain has relief. That's to say that if I stop it completely, the pain, because you help you follow doctor advice to help yourself.
Help yourself.
Not only that, pepperish food should be avoided. No eating on time, prolonged fasting
should be avoided.
Then spicy food. As I said earlier on, spicy food, maybe like suya, like food that is fried. Patients with peptic ulcer, they have to avoid those kind of foods. Beans too. Yes, patients with peptic ulcer, when they take beans, it tends to aggravate the pain.
Anytime, or they should not take at all?
Well, just like somebody will have an injury on the epithelial tissue, on the surface of the skin. When it's treated, it tends to heal. But we are talking about the influence of the hydrochloric acid as a constituent of the gastric juice acting on the tissue, either the stomach or the duodenum. The patient definitely is not supposed to forbid the beans, but if possible, reduce the intake. The truth of the matter is that some persons tend to react differently to food. And with time, they get to know that anytime I take this food, my ulcer tend to get aggravated. So when you follow those foods that tend to aggravate them, you can see that taking the drugs, you can have your ulcer treated without a reoccurrence.
Okay, the number is 052-290-573. Call the doctor, ask your question. You never can tell where it's going to come from. Hello, caller. Good afternoon.
Hello, good afternoon.
Good afternoon.
Yeah. See, I want to ask the doctor, what causes this thing I normally experience every morning when I wake up? I cannot swallow it. Even like some, I don't sleep more than 1 hour. When I wake up, my stomach is full of things, and it will be reddish, just like sweat. But I keep it through for more than 30 minutes before I'm able to swallow it. And if I'm mistakenly swallowing it, it will just give me stomach upset.
Okay, you did hear
I don't know the cause.
That every time she wakes up in the morning, she finds it difficult to swallow, as if she's got some peppery stuff in her mouth and all of that. It takes like about an hour before she can gain herself, sort of.
Well, like what she had just explained, that might not be a symptom of peptic ulcer, but however, we have to consider pathology or disease in the upper gastrointestinal tract. She might have what you call an achalasia. She might also have a pharyngitis.
What's all of that, doctor?
Yes, achalasia has to do with a problem in the esophagus, which has to do with the swallowing. That is, such patients are unable to swallow, and it's a doctor that can make such diagnosis depending on the presentation the patient is coming down with. The patient can also have what you call the pharyngitis, or a form of a bacterial infection in the pharynx, as the case may be. But however, I advise her to see a doctor to know the reason why she's unable to swallow at that early hour of the day.
Okay, you know that a lot of us do take some kind of things for granted, particularly if something is happening and within hours or days you think that is resolved, then there's always a reoccurrence, and a lot of us just stay back and say this is not happening. You wish it away. It's kind of dangerous. So see a doctor. Hello, caller. Good afternoon. Hello.
Hello, good afternoon.
Please turn down the audio level on your television set so that we can talk. Okay, tell us your name and where you're calling from. Hello. Hello, I can hear you.
This I want to ask the doctor.
I didn't get your name, sir. Hello?
Hello.
Please speak up a bit.
Hello, good afternoon. I said my name is Harry, calling from Okada, Edo State.
You're welcome.
I want to ask the doctor, why is it that ulcer is so common with the females?
Ulcer is so common, eh?
Why is it so common with the female?
With female. Okay, doctor.
Yes.
Is ulcer common among females than in the male?
Statistics have shown that ulcer is common in male than in female.
Okay.
Like as I said earlier on, the commonest type of peptic ulcer in our environment is the gastric ulcer and the duodenal ulcer. The gastric ulcer will occur when a patient is prone to what we call the gastritis. That is why we say that patients that smoke, patients that take alcohol, patients that abuse what we call the non-steroidal anti-inflammatory drugs, all these are pain relief drugs. You see, that is exactly what happens in our environment. You have pain, instead of you seeing a doctor, you go to a chemist to demand for OTC over the counter. They will give you 3-in-1 drug. That 3-in-1, they are doing the same function. And by the time you swallow this drug, it gets to the stomach and it begins to act, thereby causing perforation and injury on the stomach. You can also say that you are not prone to gastritis resulting to peptic ulcer. So, duodenal ulcer generally is common in male. Gastric ulcer is common in male. The gastric ulcer is common in group of persons with blood group A.
Okay.
Whereas duodenal ulcer is common to people with blood group O. And gastric ulcer is common to individuals who are involved in laborious, stressful activity. Whereas duodenal ulcer is common among every strata, whether you are into sedentary lifestyle, whether you are into outdoor or indoor activity. Not only that, we have also found out that gastric ulcer tend to occur in relative with gastric ulcer. And duodenal ulcer also occur in an individual whose relative has the duodenal ulcer. You can see I'm trying to look at the distribution factor between the duodenal ulcer and the gastric ulcer. Not only that, the gastric ulcer tend to be common in older age, from 45 to 65 years. Whereas duodenal ulcer is common in younger age group, and the peak age is 35 years. So you can see that from this, we can be able to tell if a patient has duodenal ulcer or gastric ulcer. But to answer the question they just asked, it's not common in female. Instead, it's common in male. And specifically, the reason why it is common in male is because male tend to have large stomach compared to female. If we choose a male of 40 years, choose a female of 40 years, and we now do an autopsy, what I'm trying to say is that we now say, okay, let's put them up and now weigh their stomach. You can see that the size of the male will be bigger than that of the female. And I told you that, though the pathophysiology, when I was explaining the origin of the ulcer, you must produce gastric juice for you to have an ulcer. And I said that there are conditions with which this gastric juice will be produced in an exaggerated amount, like this bacteria that is referred to as the H. pylori, or a condition referred to as the Zollinger-Ellison syndrome, or somebody that smokes, somebody that drinks. This causes excessive production of this hydrochloric acid in form of the gastric juice. So, a male that has a large stomach, they will tend to produce more compared to a female. So statistics generally have shown that male has peptic ulcer
dominant in the male than in the female. All right, 0522905573 is the number. When you're calling, please do us a favor. Reduce the audio level on your television set so that we can hear you. Hello, caller. Good afternoon. Hello. All right, there's somebody on the line who is busy talking. Hello. If you reduce the audio level on your television set, you will definitely hear us better, and we will also hear you better without any interference, okay? 0522905573. One may want to ask, doctor, do children suffer from peptic ulcer, like little children?
Hello?
Okay, you answer that question after this. Hello, caller, good afternoon.
Hello?
Hello, good afternoon.
Good afternoon. This is Mr. Austin.
You are welcome.
I am a male and my blood group is AA. Most times when I eat beef, I always have pain at my chest. So I don't know
If it's ulcer. Okay. Is a male, is an adult, and when he eats beans, he usually have pains.
And I know that the kind of pain you will be feeling after eating beans is epigastric pain. That means you feel pain between your two breasts, in between your two breasts, or maybe at the upper part of your sternum. Yes, I told you, I've said earlier on that there are foods a patient with peptic ulcer should avoid, and beans is one of them. So if you eat beans and you now feel that pepperish sensation around your chest area, so you know that you have, is most likely a peptic ulcer until proven otherwise.
Okay. All right, hope you got that right. 0522905573 is the number. Hello.
Hello. How is the family?
We're doing a health program here. It's got nothing to do with my family, okay? So when you call to ask question about the topic of discussion, all right? 0522905573 is the number to call. And when you're calling, reduce the audio level on your television set or move away from where your TV is. Hello, caller. Good afternoon. Hello? Hello? All right, doctor, how does one deal with recurrent peptic ulcer?
Yes.
Particularly after a surgery?
Once a diagnosis has been made and the patient is now aware of his or her condition, there are precautionary measures that have to be put in place.
Okay.
Whether complication has come up, like the complications that I said that are common to peptic ulcer include the perforation, that is hole in the organ concerned, or gastric outlet obstruction, or we can also have bleeding. Even sometimes we can also have malignant transformation. What that means is that 2 to 4% of patients with stomach ulcer can now have cancer of the stomach after a period of 10 to 15 years.
Wow.
To tell you how dangerous this peptic ulcer is. So when you have a stomach ulcer and you are now involved in other social activities that is capable of aggravating the condition,
like drinking, like smoking and stuff.
So after a period of 10 to 15 years, it's possible for that patient to not develop cancer
a possibility,
of the stomach.
but it's not in every case.
We are talking about 2 to 4%. That's
huge.
2 out of 100.
Out of 100.
4
okay.
out of 2 or 4 out of 100. That is the percentage we are talking about.
Wow.
But then you know what cancer is. So by the time it becomes cancerous, so if it's benign, it has not, it's not malignant yet.
Malignant,
that is, it has not started metastasizing, as the case may be. We might need to cut off the entire stomach.
Okay.
And that is that might be, the survivor might be, yes. So there are things that the patient will have to do to help himself. Avoid smoking, avoid drinking alcohol, eating on time. Even at night, it's possible for you to just ensure that you eat, in between meals, even if it's small, ensure that there's something in your stomach, so that by the time this hydrochloric acid, this gastric juice is produced, instead of acting on the surface,
it will act on the food.
It will act on the food itself. And sometimes when you feel the pain, you take this magnesium triosilicate in form of this, like I said, that whitish that comes in a different trade name that I wouldn't like to mention to advertise them.
You pay for the advertisement.
Or you
need money.
Yes. Or you can take milk as a way of buffering the effect of the hydrochloric acid, which form part of the gastric juice. So there are things the patient have to follow, as a way of preventing reoccurrence.
Okay. Hello?
Even after the surgery, as the case may be.
Okay, let's make this call before you answer if children suffer from it and what can be done to help those children. Hello, caller. Hello? Please reduce the audio level on your television set. Hello.
Hello,
Good afternoon.
this is my colleague from Iguadan.
You're welcome.
So I want to ask doctor. If drop soup, you always see chest pain. I don't.
If you don't reduce the audio level on your television set, sir, we'll not be able to hear you well.
Okay, anytime, if a friend of mine, anytime he eats drop soup with Eva, you always see chest pain.
If it takes draw soup and never.
I want to hear from doctor whether you have any medication for that.
Okay, when we're talking about food poisoning, we'll see if we can add that up to it. Maybe that eba and draw soup does not go down well with your friend, so you should try eba and egusi soup or black soup or any other soup for that matter, okay? I think that should just help him. But I know that since you're calling from Esan land, Esan people like Ogbolo so much, but he should try and, you know, eat something different from Ogbolo soup. 0522905573 is the number to call, and we have Dr. Jolly Nosai Goma here in the studio. All right, doctor. Hello, caller. Okay, I thought somebody was on the line there. Okay, doc, let's see how to deal with ulcer in children.
Yes. The truth of the matter is that...
Because you did say that bacteria is one of the causes.
The Helicobacter pylori is the commonest incriminating agent for this ulcer disease. And we have a way to eliminate this Helicobacter pylori. Okay. So Helicobacter pylori is not a respecter of any person. However, it is common in developing countries. Okay. Like the environment that we live, we are counted among the developing countries, as the case may be. Okay. Where you have poor hygiene, or you live in dirty environment, as the case may be. Okay. Like as I said earlier on, that one way with which we can contract this Helicobacter pylori is through man to man, maybe vomiting, as the case may be. When you come in contact with vomiting, if somebody who vomited has that H. pylori in his or her vomitus, you tend to, you know, when you have a contact with it and it comes to your mouth, somehow you already have it. However, this Helicobacter pylori can be eliminated with just antibiotics. Okay. We have a way of eliminating it. But it's still possible for a child to have what you call the syndrome, Zollinger-Ellison syndrome. A normal person, as I said earlier on, produces 1.2 to 1.5. But when you have Zollinger-Ellison syndrome, just like the way somebody have increase in urine output, you urinate more than the general group, it becomes a problem, as the case may be. So when that occurs, such patients might be put on medication. Okay. That will a kind of a proton pump inhibitor. It can be treated. Yes, that will help to reduce the production of hydrochloric acid from the parietal cells. Okay. And this patient might need to take drugs for life, as the case may be, as a way of treating this Zollinger-Ellison syndrome as a cause of peptic ulcer in children, as the case may be. Okay. But however, we have to do some laboratory investigation, either the gastroscopy or the duodenoscopy, as the case may be, to be able to know confirm exactly, to know the site of this ulcer. Like as I said earlier on, other than the history, you can use the laboratory investigation to know the site of this ulcer, whether the ulcer is at the anterior, at the posterior, at the superior, at the inferior. So though it's very expensive to do a gastroscopy or duodenoscopy in our environment, but in Western world, it's just a bedside procedure. But it's good you do it so that you know what you know exactly where the ulcer is. All right, doctor. I think we have done so much this afternoon already. If you want to do a follow-up on this topic ulcer, you can give us a call on this number, 080-34-721-750, 080-34-721-750. So give us a call on those numbers and you talk to the doctor straight up, so that, you know, you get answers to all of your questions. Thank you very much, Dr. Jolly, for Thank you for having me.
You know, free today to be with us on the program. All right, it's been quite exciting. We'll bring you another topic next week on the program, Healthy Living. Please stay in clean environment. Make sure you don't come in contact with vomit and other stuff, you know, so that you don't end up getting what that person who brought out that puke, you know, what made that person to like vomit. And if you're eating a particular food and that food does not go down well with you, I think you should stop. Avoid beans, avoid alcohol, avoid cigarettes, avoid spicy food if you know that you have ulcer and you will live long. If you do not avoid all of this, you never can tell. In another 10 to 15 years, according to Dr. Jolly, you may just come down with cancer. And when that comes, you know it's big trouble. All right? Your health is in your hands. Only you can take care of you. We'll see you again next week. Bye-bye.